I think part of it is definitely embarrassment. They either feel like, oh, I don't really want to talk about this. Like, this is just something that happens. This is just, I had a kid, or I'm an athlete, or I'm a weightlifter, and this just happens sometimes, and it's normal. And so then when they feel like it's not a problem, that's one reason why they might be reluctant. They just don't know that they can have it addressed and can improve it. And then also, especially with like postpartum and having a baby, again, they're reluctant because they're like, oh, I don't have time to do that, or this is going to be a lot of work, or this is going to be really personal, or this is going to be something my friends haven't done. So like, why do I have to do it? But then we kind of want to encourage them, like, okay, it doesn't have to be this extensive. Like, we can give you tools and educate you, and education and just confidence is huge. And it's not this scary process. It's really learning more about yourself and what your body has gone through.
I think there's a lot of misinformation out there, or a lot of people don't know that this is an option for them, or they don't know that it's actually that big of a problem. Like, my example is, a lot of times when women talk about with labor that they tore, it's not just the skin that tore. You tore a muscle. There's other issues that need to be addressed with that. If you tore any other muscle in your body, you're going to be referred to therapy. But a lot of people don't necessarily know it's an option for them, or they don't know that it's something that they should be doing. They haven't heard other people talk about it, because people don't generally sit around and talk about the problems that they're experiencing with this kind of thing. I mean, you might hear people talk about like, oh, my back hurts so bad, but most of the time you don't sit around talking about, you wouldn't believe the pelvic floor spasms I'm having, or how often I'm leaking all the time. So
or that my husband and I aren't having sex.
Yes, that's another one too. I mean, if you're having spasms and pain, generally that's kind of off the table until you can get it addressed. So people don't talk about it, and it's just ignored. So they don't know that it's an option for them to even work on.
Mm-hmm. And in treating the whole, as we're talking about, like, pelvic pain, but sometimes, someone could be coming in with hip pain, low back pain, sacral pain, and addressing the issues at the pelvic floor is just another tool in our bag, because quite often, if they're having some pain, even if it's mostly that they're feeling it in their hip, that there is some pelvic floor dysfunction going on.
Absolutely.
And having the tools to be able to assess that and then educate and treat has been, very rewarding for me as a physical therapist.
And the pelvic floor works synergistically with your back, your hip, your core. I mean, all those other muscles have to work together. So a lot of times it's not just one area that goes haywire and stops functioning, while a lot of times they have impacts for other areas.
Yeah. Breathing, the diaphragm, all these things are interrelated.
And the patients don't know that too. And it takes, eyes to see, okay, this is not actually, or it's not actually weakness, it's spasm, or it's not actually your back that's really painful. It's because you have this pelvic floor dysfunction or whatever it might be. But, a person that hasn't been educated in this or doesn't know much about this is not thinking about what their pelvic floor is doing. They're thinking about their back.
And all they've heard is Kegels.
Yeah. Yep.
So that's all we know, right?
And there's a place for Kegels.
Just not 100% of the time.
More often than not, we're actually sometimes trying to do the reverse of what the Kegels are doing. So, really seeking out that professional assessment is probably key.
Yeah.